Hello and welcome. Have you been to the hospital before and the doctor asked you to open your palms? And maybe a thought went through your mind, are doctors palm readers? So today I'll be starting a series, are doctors palm readers? Well, the quick answer to that is no. But why did they not ask me to open my palms? What are they looking for? So today we're going to be looking at the part one of the series. And so we'll start with a basic understanding of the fact that doctors are trained to be able to make diagnoses based on signs they see. So when they ask you to open your palms and they're looking at your hands, they're not palm readers. They're just simply trying to pay attention to some details that will help with making a diagnosis. So today we're going to be focusing on the DIP, that is distal interphalangeal joint. There's a video I've made which is on carpal tunnel syndrome. That video, you will learn that you have 10 digits but 8 fingers because the thumb is not a finger. I'll say that again. You've got 10 digits but 8 fingers because the thumb is not a finger. And that's easy to understand if you realize that each of these has 3 bones, but the thumb has just 2 bones. So that brings us to a little bit of anatomy. So that joint there is referred to as the distal interphalangeal joint. That joint there is referred to as the proximal interphalangeal joint, and this is referred to as the metacarpophalangeal joint. So for short, we say DIP, PIP, and MCP. So today we'll be focusing on the DIP joint. So when a doctor says, "Can I see your hands, please?" what is the doctor looking out for? There are 3 main conditions that can affect the DIPs. But before I mention these conditions, realize that there is a difference between arthralgia, arthritis, and rheumatism. I've made a video previously about that and you can have a look. But in short, arthralgia simply means pain in the joint. Arthritis means pain and swelling in the joint. And then rheumatism means pain and or swelling in a soft tissue such as a tendon, ligament, or muscle. So what are these 3 conditions that can affect the DIP? Number 1, osteoarthritis. Number 2, psoriatic arthritis. Number 3, gout. How do I then make a distinction between these 3? Well, first things, number 1, in osteoarthritis, you most likely I said, not always, you may find some bony projection, a bony lump around the joint, referred to as Heberden's nodes. If you find that, that is quite important in making a diagnosis for osteoarthritis of the DIP joint. For psoriatic arthritis, the patient will present with some other features, such as a number of them would have psoriatic skin lesions, typically elbows and the knees. Also, you may find that these patients may have nail changes as well. In which case, if you find these alongside pain in the DIP or the distal interphalangeal joint, you tend to consider the possibility of psoriatic arthritis. Number 3, gout. Although this is not the most common place where you find a patient having gout, but in patients that have polyarticular gout, poly simply means 5 or more joints involved. In patients that have 5 or more joints involved, presenting with features of gout, they could have involvement of the DIP joint. How then do I know it's gout? Typically, the pain usually will come quite suddenly, and the pain is quite severe. I've made a video on gout, and one of the characteristics of the pain of gout is most likely the most severe pain you've ever encountered if that's the first time you're having it. Typically, we refer to gout as the king of diseases and the disease of kings. I'll leave a description or the link for you to watch that video. And so these 3 conditions, how then do you manage? Of course, depends on the cause. If it's osteoarthritis, simple analgesics, sometimes requiring intra-articular injection of steroids may be necessary. For psoriatic arthritis, non-steroidal anti-inflammatory drugs, but sometimes requires the use of DMARDs, what we call DMARDs as in disease-modifying anti-rheumatic drugs, which may be conventional or biologic. And then for patients that have gout, typically non-steroidal anti-inflammatory drug, but there are other medications that we could use. Could use steroids, could use medication called colchicine. So these are some of the modalities of management of this condition. But what is important is realizing from this video that doctors can simply look at that joint and make a diagnosis, at least a differential diagnosis, until other investigations are conducted. If you've learned something, please share, like, and subscribe. See you again.